in 2 days, the world would celebrate World Kidney Day, a day set aside globally to raise awareness on the kidney and kidney-related diseases. Now, ahead of the World Kidney Day, we have in studio Evans Akwaboah, who is a nurse at the dialysis unit of the Cape Coast Teaching Hospital, and Thomas Khan. He is a kidney patient, and Thomas has been with this for more than a decade now. Gentlemen, good afternoon. Thanks for joining us.
Good afternoon.
For me, let me start with you, because look, I was there when we started to raise this fund for you. This is over a decade ago.
Yeah.
How is life for someone like you? I mean, living with a kidney-related problem.
Yeah, I think that first of all, I would like to thank you for the opportunity. But I would say that it's been very tough, and there are times you want to give up. But thank God, through it all, it's been grace. And again, I've been through the process where I've tried to psych myself to live it. There are so many people who are not able to live with the disease. Because once you are told that you have this kind of condition, you just want to give up. But thankfully, I had some kind of psychological therapy from the Cape Coast Teaching Hospital, the psychologists, and then the doctors there. I think they've done a good job not leaving the staff at the Renal unit out, because they try to, psych all of us up to, have that kind of positive mind to fight the disease.
Okay. Yeah. If you say sometimes you want to give up, what does that mean? You want to give up in terms of what?
Yeah, there are so many factors. When you are diagnosed with kidney disease, the cost is a serious matter. The cost of, treatment, that is the dialysis, plus the medication, plus the periodic labs that you have to do. Sometimes when we talk about this issue, we limit it to just the dialysis, but there are other accompanying stuff or things that you need to do to add to the dialysis, and that's even skyrocket the cost. So it's not an easy thing.
So if you say you want to give up, you want to stop treatment.
There are times psychologically, like you just get tired of everything. You get tired of life. Like you're like, to what end? And then how things are going, it will make you kind of drain you. And we live in an environment where you go, machines for dialysis is a problem, and there are times you have to give up based on you have to go to the hospital early because the machines are not enough. There are more patients. You get to the hospital, there are times you need to sacrifice your sleep and everything. You can't work like you want to do. So these are the little things, and that's one of the things that is even killing people more than the disease itself. Because there are times you want to, live life, but because of the condition you have yourself, you can't. You get it. Like I said, you go to the hospital, the machines are not enough. For instance, the Cape Coast Teaching Hospital, as I speak now, has only, I would say, 4.5 machines, and there are more than 50 patients
every day.
Every day, like they're scheduled in the days. So you go, and then let's say, as we are 3 here, you go and then just one person comes before you. You have to wait 4 hours to get to your turn because the process itself takes 4 hours. So 4 hours waiting, and then you also go on the machine for 4 hours. That is 8 hours. And before you even get the 8 hours, you would have sacrificed your sleep to get to the hospital. So it's not easy. It's really mentally draining.
You are a nurse there. So why should government care? Right, you are speaking to government directly. I want you to speak to them. Yes. You are there. You meet them every day. Maybe people in government are not there. Let's understand why government should care.
In a Western world, provisions for patients that have kidney issues or kidney failure are made to the extent that even the health workers chase the patients to dialyze them because there are machines available. We've had instances when we've met patients who travel here and then they would want to come and have a session at our place because it's a lifetime something. And you can't go away with it. Every week you have to dialyze. So they come and then when they tell us what is there and then what is here, when we compare, we see that we are far, 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 far behind. The thing is expensive. An individual cannot support themselves, no matter how rich you are. 1 month, 2 months, 3 months, mostly 5, 6, you would give up. You would run out of cash. And then you will need to solicit for funds. Your families, they will try their best at the beginning, but when it's getting tougher, they will also give up. So it is only the government who could actually help the people, because the people themselves are the government. So the money is somewhere. If it is not released to the people, they can't benefit. We will die off. And then our labor, the people are the labor of the country. So if we are dying one after the other, it will come a time that there would be no people to even work to produce what the government even have now.
So Thomas, what do you want government to do? I mean, earlier, before we came on, you were talking about something that government needs to do. What do you want them to do?
Well, I think that for quite a number of years, we've been doing this advocacy. I would say that somewhere in other parts of the continent, here in Africa, some people have been able to do it.
Okay.
Tanzania, I can say, and then South Africa and all of that. Over there, what I know is that they have systems. Their health insurance is able to cover a terminal disease like dialysis. So I think that here, Ghana can also do it, and Ghana is capable of doing it. We've been making these calls for quite some time. And here we think that with the health insurance system, if it is even difficult for government, what government can do is to just try and remove the taxes or reduce the taxes on the consumables that is used for dialysis. Because that is what really puts the price on that high level. So for instance, we know that consumables are not made here or manufactured here in Ghana. They are imported. So if whoever is going to bring the consumables goes to the port and these are the prices that he's being charged at the port, or
the duties,
exactly the duty and all of that, and the taxes on it, definitely the price will go up. So we've been pleading with government, and we still continue to plead that if government can do something about it, they should just remove the taxes or reduce the taxes. That's, I think that the prices will come down and it will save a lot of lives. Because, Kojo, to tell you the truth, a lot of people are dying not because of the disease. Sometimes just the thought about the cost of dialysis alone, that kills people faster than that.
Okay.
Remember, recently there was this story about this little girl who was from a village around Chifupraso, who died, Priscilla. May her soul rest in peace.
Yeah.
A lot of
we
the
told
patients,
a story here.
Exactly. A lot of the patients, that is the problem they find themselves in. So if government is going to do that, I think that will kind of minimize the pressure on every patient and even the various hospitals.
Since you started, what has government been saying?
We will come and we'll do something about it. But it's just been rhetorics. We've not seen any action. You know, I have been on dialysis for some time, 11 years.
Yeah, for over a decade.
Yes.
Yeah.
11 years. And it's been the same rhetorics. And I would say that not just this government, but previous government, there were talks about doing something about it. We didn't see it. This government has also come, nothing.
Okay.
And I remember we had this talk here where the government advisor on health, Dr.
Yes, here in the studio.
Exactly,
Yeah.
that they were going to do something, but till now,
They haven't done it.
I remember they said we have up to the quarter of the year, and then we are in March. So we are still pleading with government to do something about it. Sometimes we limit the conversation to just Kolebu. What happened in Kolebu was just an eye-opener. But this is a national crisis that all other hospitals should be brought to the table so that we see how we can resolve it.
Okay. All right. Gentlemen, I'm grateful to you. I hope that this day that we're going to celebrate, I mean, something will change.
Yeah.
But just 30 seconds for you. What do you want to leave there?
So what I want to tell the people is that, before you get the condition, you have a chance.
Okay.
It is better to prevent than to treat.
Okay.
Because when you get the condition, the only option for you is the renal replacement therapy.
How do you?
Or you do transplants.
Okay.
Which we cannot afford.
How do you prevent it?
So our daily lifestyles.
Okay.
Alcohol, let's do away with it. Smoking, let's do away with it. Let's live a healthy lifestyle. Exercise, fruits and vegetables. Let's eat them. So there is one thing we should also know: regular checkups.
Okay. All right.
Okay. Just before we go, talking about prevention. This whole week, on Thursday, there's going to be a free screening. If you are in Cape Coast or Central Region, come to the Kopnajan Square in Elmina.
Okay.
Just to come and test, because you will never know if you have the disease
or you don't. Okay.
Yes.
All right then. Thank you very much, Thomas Khan, and thank you too for coming.